I am a neurosurgeon, a brain surgeon, so I operate on the nervous system and a few other things related to the nervous system. Tumors and growths, blood clots that might result from a stroke or from trauma, blood vessel blockages or ruptures in the brain, and pinched nerve problems. The brain has cranial nerves that can get pinched, and our spinal column has nerves that can get pinched. So those are the operations that we do. We operate to remove stuff, tumors, blood clots, to fix aneurysms, to fix blockages, and to unpinch nerves. Typical day. Well, there are really two types of days for a surgeon: operating days and clinic days. Although sprinkled in, there'll be some sort of administrative or mostly office days. They're a lot less common. And then on top of your typical operating clinic day, you have call days. But when you're on call, you could be in the operating room or in clinic or any old day. Now, the operating days are early days. You're up, I get up usually about 5:30 because we have to be in the operating room shortly after 7. Now, clinic days start later, and so I usually have time to walk my dogs in the morning and then get here usually around 8:30 or 9, and you go and do rounds, which means go and see all your patients in hospital, and then you go to the clinic, which for us is another building. I think you've probably been down there. And that's where we see new patients that have been referred to us to see if they're candidates for surgery, and sometimes we know in advance they're not, but they need to be seen anyways and educated. Starts with prepping and draping, and we often use a computerized neuronavigation system, it's called, which includes antennas in the room that register the head in relation to some sensors that they can detect, and they fuse that with the imaging so that when we have another instrument we can touch the head and it'll tell us on the imaging exactly where we are. It takes a lot of guesswork out of planning our surgeries. It might surprise people that there are big parts of the brain where you can work cutting, making an incision, damaging, and even removing brain tissue, and the patient is unaltered by that. So we, in our business, we call that non-eloquent brain. So, don't get me wrong, there are very exquisitely eloquent parts of the brain where you can just breathe on it and something bad might happen. But there are big parts of the brain that are our windows of opportunity to get to things. And so they're obviously, that brain is doing something, and probably something important, but somehow the rest of the brain can compensate for damage in that area. So we do know that we have safe corridors to get to places. Don't be interested in my job.
I often give people that same advice.
Don't be. I think it's okay to be intrigued by, say, brain surgery. It is very fascinating, but no one was born to be a neurosurgeon. That is fiction. And anyways, it's way too early to commit to it. I think a high school student who's thinking about that far ahead should just back up and say, well, look, what about, do I want to be a doctor? Because, we're doctors first. And then, after that decision, and then you can, once you're becoming a doctor, you have a chance to get to see everything. I'm always really nervous about a brand new medical student or even a pre-med saying, I want to be a brain surgeon. So, well, what do you know about it? How about being a doctor? That's a way better thing to be. Well, I think that high school students, you know, everyone really, but sure, high school's a great place to start. Should learn basic anatomy and, you know, basic human physiology to learn about the body. And, you know, it's great knowledge, not just thinking about your career, but I mean also just to be healthy. And, you know, for athletes and non-athletes, it's just good to know about how our body works, what's good for it and what isn't.